Hello everyone. Today we're going to explore a crucial yet often overlooked aspect of our daily lives: blood oxygen levels. Did you know that even subtle signs can indicate a serious lack of oxygen in your body? Don't wait until it's too late. Watch this video to learn about 8 warning signs of low blood oxygen that you need to pay attention to immediately. Make sure you recognize these signals from your body and know how to act promptly. Shortness of breath is one of the most noticeable signs of low blood oxygen levels. When your body lacks oxygen, you may feel like you aren't getting enough air, even when you're not doing much or only engaging in light activity. This often comes with a feeling of tightness in your chest, discomfort in your chest, or shortness of breath. This is because your blood becomes too acidic, reducing its ability to transport oxygen throughout your body. This condition also forces your lungs to work harder to compensate for the lack of oxygen. 1. Dyspnea. Shortness of breath, also known as dyspnea, is the feeling of not being able to breathe or not being able to breathe deeply enough to provide your body with oxygen. This is a common sign that your blood oxygen levels are dangerously low. This feeling can occur not only during strenuous activity, but also when you are resting or performing light activities. You may feel out of breath, breathless, or need to take deeper breaths than usual. Recognizing shortness of breath related to low oxygen levels can be crucial. Pay attention to these signs. If you experience breathlessness even without strenuous activity or find yourself frequently gasping for air, it could be a serious indicator. Using an oxygen saturation monitor (SpO2) can be helpful. An SpO2 reading below 92% while resting is a warning sign of low oxygen levels. Breathing properly can significantly improve shortness of breath. Here are some helpful tips. Diaphragmatic breathing. Inhale deeply through your nose for 4 seconds. Hold your breath for 2 seconds and exhale slowly through your mouth for 6 seconds. Slow and steady breathing. This technique helps deliver adequate oxygen and reduces stress caused by rapid breathing. Improve your living environment. Minimize exposure to dust and smoke. Avoid smoking and ensure your living space has fresh air. Supportive nutrition. Include iron-rich foods, red meat, liver, leafy greens, and vitamin C-rich foods in your diet to boost red blood cell production and oxygen transport. Seek medical advice promptly. If shortness of breath is accompanied by chest pain, cyanosis, or low oxygen levels, seek immediate medical attention for oxygen support or treatment of underlying medical conditions. 2. Tachycardia cyanosis, characterized by a bluish-purple discoloration of the skin or mucous membranes, such as the lips, fingernails, is a clear clinical sign that indicates a significant decrease in blood oxygen levels. This occurs when hemoglobin, the protein responsible for carrying oxygen in the blood, is unable to deliver enough oxygen to the body. Cyanosis commonly appears in areas like the lips, fingertips, toes, nose, and ears. The bluish-purple hue arises from the lack of oxygen, causing the blood to lose its bright red color, oxygen-rich blood, and turn a darker red or bluish-purple. Central cyanosis, which appears on the lips, tongue, and central areas of the body, indicates a serious risk of systemic oxygen deficiency. Peripheral cyanosis, often seen in the fingertips and toes, is usually associated with poor circulation in the extremities. If cyanosis is accompanied by any of the following symptoms, immediate medical attention is required: severe difficulty breathing, widespread cyanosis, confusion, loss of consciousness, or fainting. If you're experiencing bluish discoloration of your skin and lips, it's important to address the underlying cause. Here are some steps you can take. Immediate respiratory support. If your oxygen levels are critically low, SpO2 below 90%, you may need oxygen therapy through a mask or nasal cannula. In severe cases, mechanical ventilation may be necessary. Identifying and treating the root cause. Underlying respiratory or cardiovascular conditions can cause cyanosis. Treatment will depend on the specific diagnosis and may involve antibiotics or other medications as prescribed by your doctor. Improving blood circulation. Keeping your body warm can help if cyanosis is due to hypothermia. Regular exercise can also improve blood flow to your extremities. Nutritional support. Consuming foods rich in iron and vitamin B12 can help boost red blood cell production. Regular monitoring. Using an oxygen saturation monitor, SpO2, can help you track your oxygen levels and detect any potential problems early on. 3. Angina, shortness of breath, also known as dyspnea, is a condition where a person feels difficulty breathing or needs to exert more effort to get air into their lungs. It is one of the earliest and most common signs of low oxygen levels, indicating that the body is not receiving enough oxygen to sustain basic functions. This condition can occur suddenly or gradually, with symptoms such as rapid breathing, increased breathing rate, feeling out of breath, dyspnea on exertion, feeling tired or breathless even during light activity, wheezing or whistling, unusual sounds while breathing. It's important to be aware of the severity of shortness of breath, especially when accompanied by certain symptoms that require immediate medical attention. These include rapid breathing, over 30 breaths per minute in adults, pale or bluish skin, feeling breathless even at rest, coughing up blood or frothy mucus, and confusion or disorientation. If you experience shortness of breath or difficulty breathing, it's important to seek medical attention immediately. Here's a guide on how to handle the situation. Initial first aid. Move the patient to a well-ventilated area, away from any stuffy environments. Calm the patient down to reduce anxiety, which can worsen breathing difficulties. If possible, provide supplemental oxygen. Underlying condition treatment. For asthma or COPD, administer bronchodilators. If the cause is an infection, like pneumonia, use antibiotics or specific medications. For cardiovascular issues, use medications to improve blood circulation or support the heart. Oxygen enhancement. If the oxygen saturation level, SpO2, drops below 90%, the patient requires oxygen therapy. In severe respiratory failure, intubation or mechanical ventilation may be necessary. Medical monitoring. Regularly monitor lung function and oxygen saturation levels. Conduct chest X-rays or echocardiograms to identify potential underlying causes. 4. Confusion. Feeling tired or exhausted is a common sign that your body may be lacking oxygen. This is because a lack of oxygen reduces the body's ability to provide energy to cells. When oxygen levels in the blood are low, the body cannot perform its normal functions efficiently, leading to feelings of fatigue, lethargy, and sometimes complete exhaustion. Symptoms of fatigue related to low oxygen levels can include feeling drained or lacking energy. You may feel tired even when you haven't done any activity. Difficulty concentrating. Low oxygen levels affect brain function, making it difficult to focus or think clearly. Persistent fatigue. The feeling of tiredness doesn't go away even after resting or sleeping. Inability to perform normal activities. Some people may feel too tired to perform everyday tasks, such as walking or doing housework. If you experience fatigue accompanied by any of the following symptoms, it's important to seek medical attention immediately. Severe fatigue that doesn't improve even with rest, fatigue accompanied by shortness of breath or chest pain, changes in mental state, confusion, dizziness, or loss of consciousness, and fatigue combined with fever or persistent cough. Managing fatigue and exhaustion. Addressing the underlying cause, treating underlying conditions. Addressing conditions that cause oxygen deprivation, such as asthma, pneumonia, cardiovascular disease, or anemia, is crucial. Oxygen supplementation. If blood oxygen levels are low, oxygen therapy through a tube or mask may be necessary. Medication. Respiratory stimulants, bronchodilators, or cardiovascular medications may be required to improve fatigue. Supportive medications. Medications that support heart or lung function, such as bronchodilators, diuretics, or heart failure medications, can help reduce fatigue. Iron supplementation. If fatigue is due to anemia, iron or vitamin supplements can improve the condition. Lifestyle modifications. Maintaining a healthy diet. A balanced diet provides essential nutrients to maintain energy levels and combat fatigue. Light exercise. Regular physical activity improves cardiovascular and respiratory health, reducing fatigue. Stress management. Relaxation techniques like meditation or yoga can help reduce stress levels and improve fatigue. 5. Tired and weak. Chest pain or a feeling of tightness in the chest can be a serious sign of low oxygen levels in the body. When the body doesn't receive enough oxygen, organs, especially the heart and lungs, have to work harder to maintain vital functions. This can lead to discomfort, pain, or a feeling of heaviness in the chest area. The pain or tightness can manifest in various ways, ranging from mild chest discomfort to intense pain. Chest pain due to low oxygen levels often differs from the typical chest pain one might experience during stressful or tiring situations. When blood oxygen levels decrease, the body sends warning signals through the nervous system, resulting in these uncomfortable symptoms. Common symptoms of low oxygen levels in the body include chest pain or tightness. This feeling can be mild or intense, often feeling like pressure or heaviness in the chest. Feeling of pressure or tightness in the chest. This is a common sign of oxygen deprivation and can make it difficult to breathe or take a full breath. Radiating pain. The pain can spread from the chest to other areas such as the shoulders, arms, back, or jaw, which is a sign that needs attention. If you or a loved one experience chest pain or tightness accompanied by any of the following symptoms, seek immediate medical attention. Severe, persistent chest pain that radiates to other areas such as the arms, back, neck, or jaw. Difficulty breathing or shortness of breath along with chest pain. Dizziness, nausea, or cold sweats. Feelings of anxiety or fear. Chest pain accompanied by a feeling of pressure or tightness. To prevent chest pain caused by low oxygen levels, it's important to manage risk factors for heart and lung diseases. Controlling factors like high blood pressure, diabetes, high cholesterol, smoking, and lack of exercise can help prevent chest pain and other issues related to low oxygen levels. Maintaining a healthy diet rich in nutrients can help your heart and lungs function efficiently, ensuring adequate oxygen supply to your body. Regular exercise, even light activities, can improve cardiovascular health, enhance oxygen absorption, and maintain stable blood oxygen levels. Regular checkups for heart and lung health, especially if you have a history of heart or lung conditions, can help detect problems early and allow for timely intervention. 6. Cyanosis. Feeling unusually tired and weak is a common sign that your body's oxygen levels may be low. When your body lacks oxygen, your organs cannot function efficiently, leading to fatigue and weakness. This is your body's natural response to trying to maintain vital functions without enough oxygen. Fatigue is not just feeling sleepy or lacking energy, it's a feeling of physical exhaustion that makes it difficult to perform everyday activities, even simple tasks like walking or climbing stairs. The level of fatigue can gradually increase, and you may feel like you can't control the weakness in your body. Other symptoms that accompany fatigue include persistent fatigue that doesn't improve even after rest, difficulty performing simple physical activities, feeling drained or as if your body lacks the strength to move, feeling apathetic and unmotivated to do anything, even ordinary tasks. If you or a loved one experiences unusual fatigue, especially accompanied by the following symptoms, it is important to seek medical attention immediately. Fatigue that does not improve after rest or sleep. Difficulty performing daily tasks, even simple ones. Feeling exhausted or unable to maintain balance, feeling like you don't have enough energy to continue, accompanied by symptoms such as shortness of breath, chest pain, or irregular heartbeat. If you experience prolonged fatigue and weakness, it's essential to assess your oxygen levels. You can do this by using a pulse oximeter, SpO2. If the reading is low, seek immediate medical attention for diagnosis and treatment. When feeling excessively tired, prioritize rest and avoid strenuous activities. Rest and relaxation allow your body to regain energy. For persistent and unusual fatigue, especially when accompanied by symptoms like shortness of breath or chest pain, consult a healthcare professional promptly. This can help diagnose and address potential cardiovascular or respiratory issues. Maintaining a healthy diet and a stress-free lifestyle can improve oxygen levels and reduce fatigue. Engaging in light exercise can also enhance cardiovascular and pulmonary health. 7. Heavy legs and cramps. A feeling of disorientation or fogginess can be a warning sign that your body's oxygen levels are dangerously low. When your brain doesn't receive enough oxygen, cognitive function is impaired, leading to feelings of confusion or difficulty concentrating. This can result in disorientation, difficulty remembering simple information, and a reduced ability to respond to everyday situations. Signs of this fogginess can include difficulty concentrating. You may find it hard to complete simple tasks or think clearly. Disorientation. You may not be able to remember where you are or recognize your surroundings. Communication difficulties. You may not understand what others are saying or speak unclearly. Drowsiness. You may feel constantly sleepy, even when it's not bedtime, and may fall asleep while working or traveling. It's important to be aware of the signs of cognitive impairment and confusion. If you or a loved one experiences difficulty concentrating on tasks, struggles to remember simple information, or has trouble understanding what others are saying, it could be a sign of a serious lack of oxygen. Difficulty communicating, such as speaking unclearly, frequently forgetting words, or being unable to complete a coherent sentence, is another indicator of cognitive impairment due to oxygen deprivation. Excessive sleepiness or drowsiness, even in situations that are not typical sleep times, can also be a sign of oxygen deficiency. Sudden changes in behavior, such as becoming irritable, distracted, or easily agitated without a clear reason, may indicate a prolonged lack of oxygen. If you or a loved one experiences a loss of consciousness or disorientation, it's crucial to check their oxygen levels using a pulse oximeter, SpO2. If the oxygen level is below 90%, seek immediate medical attention. Cognitive issues caused by oxygen deprivation require prompt treatment. Medical care will help determine the cause and provide appropriate treatment to prevent further complications. If the individual is experiencing disorientation or difficulty concentrating, ask them to stop any activities that require high levels of focus, such as driving, operating machinery, or engaging in potentially dangerous activities. Ensure a safe environment for the individual, minimizing risks of falls or accidents. Supervise them during movement or activities to ensure their safety. 8. Brittle, pale nails. When the oxygen levels in your body drop below the necessary level, hypoxia, one of the most noticeable signs is a bluish or grayish tint to your skin or lips. This is a result of the blood lacking oxygen, causing it to lose its bright red color due to the lack of oxygen and become a darker red or even take on a bluish or grayish hue, especially in areas like the lips, fingertips, and toes. Specifically, when your body cannot receive enough oxygen, your tissues and cells are deprived of the necessary oxygen to function properly. Your circulatory system tries to compensate by increasing blood flow to vital organs like the brain and heart, but this can reduce blood flow to more distant areas, like the skin, particularly those areas prone to oxygen deficiency, like the lips, fingers, and nails. Blue or gray discoloration of the skin and lips can indicate a lack of oxygen in the body. Look for early signs like bluish fingertips, nails, feet, and face, especially in dim light. Blue or gray lips are also a sign, particularly when breathing is difficult. Use a pulse oximeter to check blood oxygen levels, SpO2. If the level is below 90%, seek immediate medical attention. Call emergency services if you notice blue or gray discoloration. This condition requires prompt medical intervention to provide oxygen and address the underlying cause. While waiting for emergency services, help the person sit comfortably and stay calm. If they are having trouble breathing, provide oxygen if available or perform rescue breathing if necessary. We have explored 8 warning signs of low oxygen levels in the body. Remember, your health is paramount, and early recognition of these signs can save your life or the life of a loved one. If you experience any of the symptoms mentioned in the video, do not hesitate to seek medical attention immediately to protect yourself. Don't forget to share this video with your family and friends so everyone can learn how to maintain their health. Subscribe to the channel and hit the like button to stay updated on other helpful information. Thank you for watching, and we look forward to seeing you again.